With today being National Physician Suicide Awareness Day, I'm happy to be able to share some really important facts about physician suicide today. So sometimes we focus too much on the individual statistics about suicide. What I think is more important is for us to focus on the impact that physician suicide has on our community and our healthcare system. So on average in the United States, the impact of physician suicide means about 1 million people in the United States lose their physician every year. And that is a huge impact. So we're looking at the impact on the individual, their family, but also on our healthcare system in general. It's a very serious problem. The risk of suicide in physicians is higher than any other profession in the United States by a long shot. So sometimes people will ask, what are some of the risk factors that we should be looking out for? They're really very similar to that of the average individual. So some things that I like to share with my colleagues that are kind of specific. One, are people not keeping up their normal work performance? Are they not showing up on time? Are they calling out sick more often? Are they having trouble interacting with their colleagues at work? Meaning, are they becoming angry? Are you looking at them at their desk and they're all of a sudden tearful? Are there any signs of substance use or some major health decline? It's also important to think about if the person is having some isolation. Is this someone that you normally would see outside of work, or they're very gregarious and now they're not showing up for any kind of social activities? And very importantly, identifying if there's any kinds of problems happening outside of work. Family stress, financial stress, relationship problems and divorce are major risk factors for people for suicide. More importantly, for people like myself, knowing the resources. So knowing the suicide prevention helpline, the 988 number, being able to understand more about this by looking at the website for the Dr. Lorna Breen Foundation. There is fantastic information on the National Physician Suicide Awareness Day website. And also for friends and family who want to be supportive and know more, looking at the NAMI, the National Alliance for Mental Illness website, is very, very important. Getting mental illness, mental health, whatever you want to call it, getting that more into our nomenclature is very important to reducing the stigma and helping people through some bad days without it becoming a crisis.